Well, good morning, everyone. It's March 24th, 2021, Wednesday morning, 9:34. Apologize for getting online a little bit later than intended. However, I have to admit I signed on under the wrong name, and it took me a while to figure out that we were not on the City of Monterey logo operating. So again, my apologies for signing on a little later than usual. Nevertheless, welcome, and I hope you guys join me and find the right link and are better than I am with my YouTube skills. So again, my apologies for starting 5 minutes late. I wanted to talk today about a few items that are keeping us busy here at Monterey City Hall. And let's start with good news. The American Rescue Plan that was approved by President Biden will channel about $6.5 million in funds towards the city of Monterey. Those funds that are coming to Monterey will be sent in two installments of 50% of that sum. So we expect in about 50 days or so that we are receiving $3.25 million of American Rescue Plan funding towards the city of Monterey. And those funds will come with no restrictions to us, or stated differently, aside from using it for pension cost, we can use the money to help us with our revenue losses that we have experienced over the past 15, 16 months or so. The $3.25 million that we are getting are actually just about 19% of the revenue losses that the city of Monterey really had. Our revenue losses are something between $30 to $32 million right now, and $6.5 million paid over a period of 12 months will cover 19% of our revenue losses. So it is still a good news story, because in the end, the $3.25 million that we get in 50 days and the additional $3.25 million that we will get hopefully next year will really help us to manage our budgets. And so we're talking about the budget now a little bit to explain what is going on around City Hall and where in what direction our city staff is moving right now with respect to defining the new service levels that have to be based on a good dosage of realism and a good dosage also of what we project as future revenues coming to the city of Monterey. All of us know that our main revenue source is the hospitality industry. The hotels and the restaurants are our main source of income for the general fund. And then, of course, we have the parking fund with their parking revenues, as well as the Tightland funds with the revenues of operators that are working in the Tightland areas. These are mainly the Wharf One restaurants. If you have a visual for that, these are the restaurants that are operating in the Tightlands. So we expect that those revenues will be coming back to a certain degree. The largest impediment right now for the recovery for us is, of course, the conference center. The governor has not made any moves with respect to how they see conference center business develop. While the restaurants in the red tier are open up to 25% of their seating capacity, nothing is moving right now with respect to conferences and gathering. And that's totally okay, because as we all know, we are hopefully at the back end of the pandemic, but still we have to move carefully into reopening of that. I want to say that we are working the budget angles right now, contemplating how are we using the $3.25 million, and the interesting part of that is that we have several large scale operations in the city of Monterey, which we are in the process of reopening, and they will consume definitely the bulk of those funding. One of them is, of course, our sports center, and we were able to reopen the sports center this week, Monday morning. And at 8 o'clock, we had a line of folks. When I say a line, there were about 10 folks or so waiting to get into the sports center. And we opened on Monday morning at 8 a.m., and our team was able to uh, bring on staff on a short-term basis to help operate this facility in a safe and COVID compliant manner. And one of the objectives was that we have enough staff there to ensure that our equipment gets cleaned regularly, and also that we have enough staff there to ensure that the facility is clean and safe and everything is functional. So we welcomed back on Monday, I think something like 60 to 70 customers. Now that is pale to what we usually have in the sports center, but we are allowed to have about 120 to 140 folks in the sports center. Sports centers are allowed to operate at 10% capacity, so we were well below that. But what was surprising for us, and I hope you find this also as a little bit of good news, we had quite a few people coming to the sports center and signing up for the sports center passes again. So we had quite a few folks that went to the front counter, either renewed their membership or purchased a brand new 1 year membership. And right now, our team is running a special where basically they are offering 12 months or 13 months at the cost of 12 months. And as you know, the Sports Center never has sign up fees or all those other fees that some private clubs or private operators are offering. But the sentiment on Monday was really positive, and it was different than when we opened in June last year for a short period of time. You may recall we had uh, uh, we were open for a little less, I believe, than 5 weeks or so until we had to shut down again. But it was a different atmosphere, and that is kind of reflective, probably also about the overall cautious optimism we are experiencing with respect to COVID-19 and the vaccine rollout here in Monterey County. So it was a great opening, and I'm very, very proud of our team to pull that off. As you know, as a local government, as a municipality, there are a lot of rules and regulations we have to go through when we are hiring folks, when we are bringing folks back onto payroll, and we somehow pulled it off. We don't use Sign Up anymore. Sign Up Genius anymore. You can drop in at the sports center and you will be welcomed there. And again, the maximum capacity is, I believe, 110 or 120 folks. Our operators know it better than I do. The other question that we always get asked about the sports center is when will the pool open? And I can share with you that we threw on the switch for the pool heater. So we are heating up the pool again, and we are, of course, running all the systems to operate the pool in a safe manner, the filter systems, etc., etc. And so it takes about 2 weeks until we are really having the pools up and running. As you can imagine, this is not just a bathtub. This is a huge, huge pool with a lot of water, and it takes its sweet time until it has the right temperatures. We plan on opening the swim gym sometime early April. I've asked our team to please work with our staff, the public outreach staff, and come up with a date, because I feel it's important for you all to know when the swim gym will be available. Fortunately or unfortunately, we have started a project just before we went into the red tier, or came out of the purple tier and went into the red tier, that will fix the pool decks. And you might ask us also, why did it take you so long to fix the pool decks? Why didn't you do it earlier? Well, the simple story is, we didn't have the funding for that, and it took us a while to scrape money together to find the funding for the pool decks. That was a project that was originally funded by the NCIP, and it was important for us also to find now money to have that fixed as well, so that the users of the swim gym have a better pool deck than they had when we closed it down. So fortunately or unfortunately, that project is in full swing as well, but everything will be ready and accessible by the beginning of April. Presently, also the TIA regulations from the state allow drowning prevention classes only. And so we will find a way in opening up the pool under the conditions as approved by the state. And we know from a lot of folks that really the swim gym is something that they are really missing as well. And our aquatics coordinator, a full-time position, which we laid off in June, has returned, and he is working feverishly to organize a safe pool operations, which includes, of course, hiring the right amount of lifeguards to ensure physical safety of our swimmers and pool users as well. So, good news, the sports center is operational. Swim gym will be open early April, and we will make an announcement when that will be, and we're very excited about that news to share with you. On the library side, let me assure you that the library director is following also all the regulations that are coming out from the county as well as from the state of California. For the moment, we will continue to have the curbside pickup. That is a very successful program, and we will continue to have that. But I can share with you that the library board and the library director have been working also on a budget proposal, or a budget suggestion that the library board will provide to the city manager's office and the city council for a reopening of the library. And again, I believe that may happen actually this week, that the library board may look at those recommendations and then discuss it among themselves, and then they will give us a recommendation of how they would see the budget. Now, what you have to know also is that all the different departments are preparing similarly their budget proposals. And in the end, what we have to face is the reality that our expenditures and our income, our revenues have to match. And that's what is the job of the finance team and the city manager's office, to ensure that we balance our expenses with our income. And one of the elements that we will be proposing to the council in April is with respect to the reopening of the sports center and the conference center and the library and our rec centers, a very careful, balanced approach that we can foresee with respect to sustaining certain service levels. And this will go on probably for the next 3 to 5 years. We cannot just expect that just because we have our facilities all opened, hopefully by the end of 2021, we cannot expect that all service levels will be restored at the same level. And everyone understands that, and everyone understands that this is one of many generations crisis we are still in. And as such, our municipality has suffered significant revenue losses, and we need to create a better, sustainable service level inside our local government with respect to all the expenses that we are facing. And trust me, this is a 360 approach. We will look at everything. We will look again at everything from our hiring practices, our salaries, but also to what we are delivering as service levels to our community. So the budget, the library budget, the recreation budget, every single budget will be reviewed, and we will look really into the future and project what we think we will receive as income. If there's something what I learned, if there's one thing I really learned for over the past 12 months is that if you think the worst case scenario can happen, think a little harder. It can get even worse than the worst case scenario. And I think prior to COVID-19, none of us would have estimated this extent of a worldwide crisis. We would have never thought that we would have over 80 facility, I don't know the right number right now, but that we would have over 550,000 fatalities in the in the United States stemming from COVID, that we would have over 30 million folks infected with COVID-19. We would have never expected so many industries having challenges. And it is pretty clear that the hospitality industry was hit the hardest across our nation. And as part of that, of course, the city of Monterey was hardest hit. So when we look at our projected budget estimates, we will be ultra conservative, and we will be also ultra conservative with respect to restoring service levels. That's what we owe to you, the taxpayers, to ensure that we are not jumping way ahead of the curve and making costly mistakes. So that a multi-year recovery plan is something that we are working on, and we will probably try to project or create a plan that covers the next 3 to 5 years. It is a false assumption to believe that by July we have everything open again and everything opening at the same level. There have to be choices, and there have to be choices made by the city council ultimately, because they are the decision makers and they have to make tough choices. One of them will be, for instance, also that we will propose to the city council not to fund the MST trolley. We simply cannot afford to spend $450,000 to $550,000 on a free trolley service for our visitors. We all understand the high benefit that the trolley has, but it comes at a great cost. And so one of those things that we will be proposing, and that I know will be discussed with our hospitality partners and maybe even with our residents to a degree, is that we will be having to endure not having the Monterey trolley running all year round at a tune of $550,000. Now, the aquarium also chips in a great portion of that, about $110,000 in addition to the city contribution. But unfortunately, I don't think the city can afford that. Parking revenues are way down as well. And so we have to use the next 12, 24 months wisely also with respect to our parking fund. So that's what I wanted to share with you about the budget, about the reopening, and about the American Rescue Plan. I think closing that topic out, the American Rescue Plan is really helpful for a lot of communities. The allocation, I was asked by a resident over the weekend, how did they come up with $6.5 million for Monterey and $50 million for Salinas? Well, the allocation was made based on Community Development Block Grant allocation, CDBG, and those numbers take under consideration a few factors. One of them is how many residents live in a particular town. Monterey has 28,100. Salinas has a little over 158,000. Another factor they take under consideration: what is the poverty level in each respective town? As you know, Monterey's median income is probably higher than the median income in the city of Salinas. And another element they take under consideration is also elements such as housing. So that's when you look at the different numbers for cities. It was not made based on the revenue losses, but based on that formula. And when you look at the revenue losses that the city of Salinas had and the revenue losses that the city of Monterey had, they are quite operating in two different worlds. I told you earlier that the city of Monterey has significant losses based on our hospitality-based industry. And just to give you another flavor of that, we are among the top 12 cities in the state of California affected by revenue losses. We are accompanied by cities such as South Lake Tahoe, such as Anaheim with Disneyland and other tourist destinations. So, having said all that, the American Rescue Plan, one might want to criticize how they allocated the funds. From my perspective, is a great tool for us. It really helps us with the allocation of funds that we have. And we are really grateful to the good work that was done in Washington by the Democratic elected leaders. And I can say this because none of the Republicans voted for the Rescue Act. I think it's a wide, far-reaching act, and we are grateful for the work that was done on behalf of local governments. It's the first time in the history of the United States that local governments are receiving support from the federal government for revenue losses. So it's truly a historic bill, and we are very grateful for that. My last topic that I want to talk to you about is vaccinations and COVID-19 data. As you can tell, the curve in Monterey is flattening out. You can hear two different versions from the health department officials of the county. One version is that they are still concerned that we are plateauing out now, that at a level that they hope would be lower. The other one, though, is that the health officials are cautiously optimistic about moving into the next tier, which is orange, in hopefully 2 weeks. So what that means in essence is we got to remain vigilant. We got to be compliant with all the recommendations from the CDC and the Monterey County. We will not take down our mask compliance orders for Cannery Row as well as for Fisherman's Wharf. We will still encourage everyone to wear a mask and have our signals, our CMS signs, changeable message signs that you see at the entrance to our town will still remind everyone of wearing face mask, and we will not let down our guard. But overall, the Monterey County Health Department is very optimistic. I want to talk now briefly about vaccines. The situation of receiving vaccines has improved. I don't want to use the word dramatically improved, but it has improved. We have received thousands of vaccines, and thousands of folks in the county have been vaccinated. The City of Monterey Fire Department is the only fire department in the county right now that is authorized to receive doses of vaccines and is authorized to administer doses of vaccines. And that is quite an accomplishment that, again, we should be equally proud of our fire department, who started that process in December, and since then has administered, I believe, close to 1,700 doses of vaccines. Having said that, other fire departments can apply also to become an agency that is allowed to receive vaccines. But all fire departments who have paramedics can use vaccines to inoculate people. And based on that, we had last week an event that I wanted to share with you and kind of explain it, because um, we received some emails from folks that expressed some concerns about vaccinating homeless folks. We received last week, or the week prior to that, I believe, we received 500 doses of the Johnson and Johnson vaccine, and they were sent to us with the request to our fire department to find homeless and inoculate as many homeless as we can with the Johnson and Johnson vaccine. So the vaccines that were sent to us came with the responsibility to find homeless and provide them also with a vaccine that does only require one shot. And we heard some concerns from residents that sent emails to us saying, "Well, that's great that you vaccinate the homeless, but what about me?" And we understand those kind of questions. Point though is, we also have to look out for those folks nobody else looks out for, and part of them are homeless folks. And so those 500 doses of Johnson and Johnson that we received were dedicated by the state and by the county towards homeless folks. And we did a clinic on, I believe, last week, uh, Tuesday morning, I believe, or Wednesday morning, at Gathering for Women, where we inoculated about 120 folks that came to that clinic. And then, together with the fire department of Seaside, we went with our doses over to Seaside and had another 180 folks inoculated out in Seaside at a location on Fort Ord. So the Johnson and Johnson vaccine is now in the arms of about 300 folks that belong to the most vulnerable community, and that is also an accomplishment I'm proud of. On the other side, vaccines in the city, throughout the city, have become more accessible. When you see on Mondays, Montage Health, Chomp is opening up clinics. This week alone, they had 3 clinics, two in Marina on Wednesday and Thursday, and one more in Monterey on Thursday, tomorrow. When you watch the sign up there, you will see that the sign up takes more time now. People are not standing in line, so to speak, to sign up. It's easier to sign up. People keep signing up over a course of 8-10 hours. And so the Montage Health Clinic does a wonderful job. They are, again, close to 26, 27,000 vaccines administered so far. But what you see is that other providers, such as Rite Aid at Del Monte Shopping Center, or Walgreens, or Safeway, or CVS, they all are providing also vaccines, and a great deal of folks have been able to receive vaccines. Yesterday, I got an email from a resident who shared with me that he has a challenge to sign up his 73-year-old mother. And I don't know if I was helpful or not, but I provided that person with 3-4 different links, and I got an email back a couple of hours later that he was able to sign up his mother, 73-year-old mother. So I don't know if this had anything to do with what I provided him with, but I think vaccine situation has dramatically improved. The Monterey Fire Department will remain a vaccination agency. Right now, there is a switch between the vaccination distribution system, and one of the switches is that the city will probably become a partner of Blue Anthem, and we will probably get doses now in the future from through them. So again, stay tuned. There is somebody who commented, Arne Hildebrand from Anna-Lena Reimers. So hi, Anna, nice to see you. Hope you're doing fine. But as you may or may not know, I follow also vaccinations over in Germany, and my 74-year-old sister, her turn is in April to get a vaccine. So when you look at what we are doing in the United States, when you look at where we are now in California, um, we are really way ahead of the curve of some of the most developed countries, and countries that have also a great medical system like Germany. But again, 63% of folks older than 65 in the United States of America have received vaccines so far, 63%. And again, just to mirror that, my 74-year-old sister in Germany is scheduled for her shot in April. So our vaccine situation has dramatically improved, and we will keep everyone updated about the progress. Our daily email that our team is sending out has numerous links for sign-up clinics, and last but not least, it also reminds everyone. It reminds everyone how to stay safe, and we have to be vigilant about that. Uh, okay, so that's all for today. uh, I um, I want to let you guys know. Thank you for joining us, Anna. Thank you so much for emailing me. No, we don't have COVID testing requirements for entering stores and institutions. Here in the United States, grocery stores are allowed to reopen at 100% capacity, and no one will be testing you when you go into a shopping mall or into a grocery store or into any other facilities right now. These are discussions also that happen and have happened on different levels. If you can require vaccination certificates, I would cautiously say, comparing it to other societies I know over in Europe, this will be a heavy lift if you want to create that here in the United States, to have vaccination requirements shown before you go. There are a lot of privacy issues that the folks in California will bring up, so that will be very difficult to implement. So with that, great to hear from you all. Thank you so much. Vielen Dank. And I hope to see you again in 2 weeks. Stay safe. Be careful out there. And as always, I so much appreciate the support that you guys are giving your city here in Monterey. And please let me know when we make mistakes or where we can do better. 24/7, we want to be your partner and want to make the city the best city you can live in. So with that, have a wonderful day, and see you soon. And maybe in 4 months or so, we will be allowed to meet again in the library community room. Let's hope we meet there. Bye bye.